In 2013, at the end of December of 2012, your group health care plan from Battelle is ending. It no longer exists. Okay, remember, it's our job as benefit advisors at Extend Health to help you find an individual policy. And you'll have one of two core options that you can choose from. The first being a Medicare Advantage type plan. And we'll take a deeper dive on how these policies work in a minute. But this first core option that we call a Medicare Advantage plan is an all-inclusive comprehensive plan that covers hospital visits, doctor's office visits, and your prescription drugs. Your second core option, maybe you get on the phone with your benefit advisor and you have that discussion and you decide that the Medicare Advantage plan isn't right for you. Your second core option are what are known as Medicare Supplement or Medigap plans. Okay? A Medigap plan basically works with A and B of Medicare to fill in gaps that are left out. And like I said, we'll take a deeper dive in a minute here so we have a better understanding of how they work. The Medigap policies do not include prescription drugs, so it's also my job to help you find a Part D drug plan that covers your medications and is cost effective for you. Dental and vision is available if you'd like it. So make sure that if that's important to you, you talk to the benefit advisor about the dental and vision plans available. You can see a snapshot up there of some of the insurance carriers we're doing this with. Just a few of them, but AARP, Blue Cross Blue Shield, Humana, Cigna, Aetna, SumaCare, Express Scripts through Medco. So there are a variety of insurance companies that you know and are familiar with that are providing these types of policies to you. My job as a benefit advisor is threefold. First and foremost, I have to educate the retirees on exactly what's going on. So yes, your group plan with Battelle is ending at the end of December. Yes, it's my job and my responsibility to help you find a new plan for 2013. Of course it is. I'll have a discussion with a retiree on the phone about how Parts A and B of Medicare work, what they cover and what they don't cover. We'll talk about supplement plans versus Medicare Advantage plans, the primary differences between those plans. We'll talk about how the donut hole works, and then I'll answer whatever questions you have, and I'll listen to retirees vent and be frustrated and upset, and that's okay. By a show of hands here, how many people are confused about this process or worried about what's happening? Okay, so you see the same thing each meeting you go to. There's trepidation, right, about what's happening, and that's okay. That's why I'm here. In any event, my first job is to educate the retiree and get on the same page with them about their health care. It's my very first job. Once we've done that, and once we've had that discussion, and you don't have any additional questions, I'm going to begin evaluating what's important to you in a health care plan. So what does that mean? It means I ask you a series of questions. How often are you going to the doctor? How many doctors do you see? How often do you travel? Do you live somewhere else 6 months of the year? What do you like about your group health care plan? What don't you like? What insurance companies do you hate? So I go through a series of questions to better understand what's important to you. I'm evaluating your individual needs as a retiree for a health care plan. Once we've done that, I'll use our exchange, those 80 different nationally and regionally recognized insurance carriers, and I'll make a plan recommendation or two to you, the retiree. I'll say, you know what, Mr. Jones, this Medicare supplement plan and this drug plan fit what we've just talked about. It's cost effective for you. It covers your doctors. It allows you to go to the hospital that you want to. You know, how do you feel about that plan? And the retiree will say, Colin, it sounds great. Let's enroll in that plan, or I want to, let's talk about something else. Whatever it is, eventually we come to a decision, an agreement about a healthcare policy that works for you, and I will enroll you in that plan over the telephone. Okay? Your voice constitutes your signature. There's no paperwork you have to sign and send back. Everything's recorded. We'll talk about it here in a minute. But it works very well. It's very simple. Now, we did these meetings yesterday, and we'll do these meetings tomorrow and the day after. And I'm going to tell every single group the same thing. These two boxes with these three things, education, evaluation, and enrollment, are simple and straightforward. Okay, I can take any retiree in this room, and I can sit down with you and have a discussion about your health care. I can educate you on what A and B cover and what they don't cover. I can enroll you in a policy using the tools that Extend Health. Those things are simple and straightforward. What I can't do is predict what's going to happen down the road to retirees. So I don't know what new drugs people are going to start taking in April or May. I don't know if a doctor is going to leave a network. I don't know if people are going to have surgeries or go through chemotherapy treatment or get divorced or move or buy a new home. These are life events that happen every single day that we're unable to predict. So with that said, my most important job every single day is to be an advocate for a retiree. Okay? To manage your health care in 2013 and beyond. Indefinitely. Okay, so when these things happen, when you start taking new drugs, when a doctor leaves a network, or you're thinking about buying a new home and living in New Mexico 6 months of the year, give us a phone call. Okay? We will educate you on how it impacts your health care, and we'll walk you through that process. Okay, don't hesitate to call us. We probably spend maybe 30 or 40% of our time doing these things, and a whole lot more time during the year managing people's health care and making sure they're comfortable with the plan that they're enrolled in. Extremely important to us. My hope is that everyone in here has this Getting Started guide. If you don't, come chat with me afterwards and we'll get you one. The Getting Started guide is a piece of material from Extend Health. It came with a letter from Battelle, and it asks you to do 4 things. Write down your doctors, write down your drugs, write down your red, white, and blue Medicare card information, and call Extend Health. Okay. Who here has done that? Oh, fantastic. So a good amount of you. That first phone call, when you phone us, or when we phone you, and we collect that information, our goal is to set an appointment with you in October, November, or December to discuss plan-specific options that are available to you. So we'll set up an appointment. It might be November 2nd at 2 o'clock. It might be December 3rd. But our goal is to set up an enrollment appointment phone call with you, the retiree, on that very first phone call when we talk to you at Extend Health. One of the most important things that I want to talk about today is the idea that pre-existing conditions will not impact your plan availability or your plan pricing. Okay? So the group plan from Battelle is ending at the end of December. It allows you, the retiree, a special enrollment period to enroll in any individual product you'd like with no medical underwriting, guaranteed issue, no impact on pricing. So it doesn't matter what medications you're taking or how many surgeries you had last year, you're guaranteed issue into these plans. The one exception is if you have end-stage renal disease, which is kidney failure requiring dialysis. There are still solutions available for you, however, a little bit more limited if you do have ESRD. If that's the case, again, come chat with me afterwards. So you dial Extend Health, or they call you and you give them your information. You set up your appointment phone call, and probably a week to 10 days after that, you'll get this enrollment guide. It's a piece of paper that says, thank you for giving us a phone call, or thank you for talking with us. We have your appointment scheduled for December 10th at 1 o'clock in the afternoon. Please give us a phone call at this number at that time. And you say, great. This enrollment guide that it comes with talks about the basics of original Medicare. It talks about Medicare supplement plans, Medicare Advantage plans, Part D drug plans, the whole gamut. Okay? If you would like to use the internet, we do have tools available for retirees to get online at www.extendhealth.com/Battelle. And if you'd like to, you don't have to, but if you want to, you can get on there and you can build your profile, put in your doctors, put in your drugs, tell us a little bit about yourself. You can set up an appointment. You can do all those things. It works exceptionally well. It's a great tool. I usually discourage people from using it. My company pairs people with people, not people with technology. Okay, so if you're happy doing this, by all means, use it. But we really want you to talk to a benefit advisor, get your questions answered, and go through the process like that. But like I said, this is available for you to use. Who are the people that you're talking to? The benefit advisors are, again, in Salt Lake City, Utah, or in Dallas or Richardson, Texas. So everyone is U.S.-based. We don't outsource any of our work outside this country. The average age of the benefit advisors is 43. So we're usually talking about seasoned career people that have been doing insurance for a long time. A lot of them have been doing it longer than I've been alive. So we're not taking people right off the street and then connecting you with those people so that they can help you make healthcare decisions. The process to become a benefit advisor is rigorous. Okay? You have to begin by passing an examination in the state of Utah or the state of Texas to become a licensed health insurance agent. It's not an easy test. Once you've done that, you go through a variety of background checks to become a benefit advisor. And then you go through several weeks of licensing, appointments, and certifications with different insurance carriers and in different states so that you can begin to work with retirees. However, long before you ever talk to a retiree, we also put our benefit advisors through 5 weeks of what we call Extend University, where we teach them the ins and outs of original Medicare. We teach them how A and B of Medicare work, how supplement plans work, how Medicare Advantage plans work. We teach them about the donut hole and the coverage gap. We teach them how to talk to an 85-year-old widow who lives on her own, how to talk to her about why her health care is changing and how the process works. And it's not easy. It's difficult. It's a difficult part of our job. We simulate what it's like to have cataracts. We have advisors put on goggles that simulate cataracts, and we throw them on a computer for half a day, and they see what it's like to be, maybe 80 years old and having bad eyesight.